Hello everyone, I'm Dr. Parth Shah, oral and maxillofacial surgeon and also a director at Casa Denti Clinic, Navi Mumbai. I'm going to be touching upon a very sensitive topic, which is a myth in dentistry, that dentistry is very expensive. It is not at all expensive. It is a myth, and only neglect in the field of dentistry is expensive. As opposed to any other field, patients immediately run down to the consultants or to the expert to visit them at any given problem or any particular thing they want to refer to. But always I have noticed that anything related to the tooth is neglected unless they have severe pain. So how do we address this issue? As a common patient, you must visit your regular or nearby dentist every 6 months and then not wait for the onset of pain or for anything drastic to happen in your mouth. A basic treatment, that is cleaning or commonly called as scaling and polishing, should be done every 6 months or twice a year maximum. For smokers, pan chewers, tobacco chewers, this treatment can be done within 3 to 4 months, but the frequency of the treatment should not be increased. A common myth surrounding this treatment is that दांत का first layer घिस जाता है या erosion होता है. That is not at all true. This, we use a small tip, or it's called a dental scaler, and it goes within the gaps of your two teeth, and it removes the plaque, the calculus, and the food which is generally stuck, which cannot be removed with the help of a toothbrush. As I have commonly noticed in my career so far, that patients generally avoid this treatment or don't bother to do it, and then suddenly after months or years of not visiting a dentist, they come down with a decay or a cavity. This too can be addressed without any invasive procedure, just with the help of a dental filling, which is exactly the color of your tooth. It's also called as a tooth colored cement. This dental filling helps to solve the decay between the first and the second layer of the tooth. It is generally done to prevent the decay from going into deeper layers of the tooth. This replaces the enamel and it looks exactly in the form and shape and the color of your existing tooth. Again, moving on, if this step also is neglected or not attended to, it goes into a more decay or a bigger problem, which can be called as a root canal. This is a little more invasive and can be done by a general dentist or an endodontist. A common myth surrounding root canal treatments is that it is extremely painful and requires multiple sittings. This is not true at all, as nowadays the advancement in the field of dentistry has reached far and wide. So this treatment can be done within 1 sitting or 2 sittings at the max if the infection or the decay is not widespread. It has also become a painless procedure with the help of anesthesias and multiple topical agents. And this is also done with a latest invention in dentistry, is the help of a endomotor. The more you neglect this, even at the root canal stage, then it finally reaches the stage where you have to remove or extract the tooth. This is definitely more invasive, slightly more painful, but it can be achieved. One has to replace that missing tooth with either a cap or a bridge or any sort of a dental implant, which my colleague will be talking about it in the next video. So I would like to conclude by saying that dentistry is not at all expensive if it is attended in the first go itself, as I have explained in the starting of the video. Just by a regular checkup to your dentist or a basic cleanup once in 6 months, you save tons of money and also a great deal of pain, fear and anxiety. So thank you for listening to me, patients.